Hi, everyone. Thank you for tuning in. We are going to be together for an hour discussing healing from depression. And we will be replying to any of your questions, any comments you'd like to make. We've also had some clients who wanted to share part of their personal journeys with us, so we will be speaking to you about that. With me, I have two members of my team at Polaris. I have Dr. Anka Gurara, our psychology practitioner, and we have Dr. Gabriel Elul, who is our psychiatric registrar. And the three of us together are going to offer you as much support as we can in the form of this live feed discussion. So please feel free to join in at any point and come in with any questions, as I said, or comments that you might have. Okay, will we go? All right, so we have a number of questions that have been coming into us over the last week, and I'm going to start with them, not in any particular order. Okay, so one client sent us a message because they are concerned that they may be suffering from depression, and they're asking, how do I know if I actually do have depression?
Yes.
So would one of you like to take this, Gabriel?
If you like, yes. Thank you for your introduction. And I look forward to helping out with this live panel as much as possible. Usually depression is diagnosed after a period of low mood, which is accompanied by a number of other symptoms. It is a clinical diagnosis, so it needs to be done by a certified professional. And the symptoms are grouped into clusters, so it's even easier for everyone to remember. So there are the physical symptoms like changes in appetite, which may be a loss of appetite or an increase in appetite, changes in sleep pattern, which usually leads to a disrupted sleep, and changes in energy level. Usually people who have depression are tired all the time, they're easily fatigued. Then there are the emotional cluster of symptoms. So you have low mood, you have a sense of possibly guilt, anger, remorse, frustration, and so on. And then there are the psychic or the cognitive symptoms, which include a poor concentration and thoughts which are related to hopelessness, helplessness, and so on. Sometimes people in severe stages of depression also have thoughts about death and suicide, and obviously that makes things even a bit more complicated.
Thank you, Gabriel. That was an excellent description of the symptoms. I'd like to also add to that that there is also a difference between the normal run-of-the-mill sadness that we feel as human beings and experiencing depression. So as Dr. Gabriel said, there has to be a persistent experience of low mood. So those of you who feel sad from time to time, or at certain times in the month, or have gone through a difficult experience and are feeling low, this is not necessarily what we would call depression, but it could be a normative experience, which all human beings actually go through, okay? Anka, would you like to add something to that?
Yes, I would like to add the fact that, as Gabriel was saying, it's very important that clinician, a professional, would assess the mood. Because, for example, the feelings of sadness, of rumination, or the poor appetite are very normal responses to life events, like, for example, losses, loss of a person, or loss of a job, or any medical, for example, a medical condition. So this might be very well related to normal life events. But a clinician can assess best if it's a depression or not, taking into consideration the person's history, right? And the cultural norms of the expression of distress in the context of loss. So obviously, for example, if we talk, people sometimes who lose someone, if a person passes away and the family, for example, they start to feel, they start to grieve, right? At some point, people ask themselves, am I in a depression? And I guess that there are some common elements which we can find in both depression and grief. But in the same time, if we have a little bit of time, we could explore a little bit maybe the differences, because there were a number of clients, for example, who came to an assessment after, for example, after 2 months of grieving, which, as we know, it's quite a short period of time to define, for example, depression, or to put this diagnosis. For example, in grief, it's very common, the feeling of emptiness, right, and of loss. Whereas in depression, for example, what it appears to be very striking is the depressive mood and the inability to enjoy simple things, to anticipate sometimes happiness, right? As well, while in, for example, in grief, it's very common that sometimes there are, for example, positive emotions and even humor. This usually in depression, it appears to be rather a state of unhappiness, let's say, which is very persistent. It's throughout the day, most of the day, as we know, in a very consistent way. And I think that what is extremely important to differentiate, for example, between these two would be that while in grief, the self-esteem is preserved, in depression does not happen the same, because the person going through a depression has these constant feelings of worthlessness, right? Rumination and and I think that if we had to add another element, would be that in grief, this periods of sadness, they tend to appear in waves, right? Whereas in depression, they tend to happen on a constant way. Mm-hmm. And I felt the need to discuss about it, as a lot of people were wondering, and I had a lot of clients asking about it.
Mm-hmm. Absolutely. I think it's also important to say that sometimes grief can become a depression when it's a complicated form of bereavement, you know. So as much as we can distinguish between the two, it's also important to know that sometimes they coexist as well at some point. So, okay, will we move on to another client's question? Let's see, we have more coming in. I hope we can get to all of them. Okay. So, 1 second. Okay, so I have another question. This client says, I'm 31 years old. I was diagnosed with depression when I was 3 years old. And later was also diagnosed with that I'm on the autistic spectrum. My question is, besides medication and counseling, what else can help me to overcome depression, especially since I am on the spectrum? Will I ever be 100% independent since I have depression and am on the spectrum? Thank you. Okay, a very interesting question. Gabriel, do you want to take it?
Of course, if you'd like me to start. I find it quite strange that the diagnosis was done at 3 years of age. Maybe there was a a typo in the message itself. Maybe it was 13 instead of 3, and probably that digit wasn't actually communicated properly. But so early diagnosis of depression is usually accompanied by multiple obstacles which the individual would have to face, especially in the early teenage years, where, as Dr. Ranga rightfully said, there would be feelings of worthlessness, low self-esteem, and so on, and that will obviously impinge on the individual's prospects and his decisions in life. And that is why early intervention, early treatment and management is very much important. The individual, the gentleman also mentioned that he has autism spectrum disorder, if I recalled well, or Asperger's.
Yes, we don't know if it's a male or a female, actually.
Okay, okay. So the person who spoke to us, the client, actually mentioned this neurodevelopmental disorder, which falls under what we now know as autism spectrum disorder, which is basically a type of disorder which leads one to find it more difficult to communicate, even to interact socially, and it will also make one less adaptable to the normal changes of life. So someone who suffers from autism may find it more difficult to change daily patterns, even though that change may be necessary. And obviously this may predispose to other issues such as depression. And in fact, as the individual rightfully said, I mean, he has been struggling with these conditions for quite a while. And he was asking, if I recall well, whether he would need anything else apart from medication and counseling. And my advice would be to try to seek professional psychotherapy. Okay, so that maybe one would be able to receive direct guidance on how to maintain a healthy lifestyle, be resilient to life's changes, and adapt his own qualities as a person who has autism to the normal life which he intends to lead. Having autism isn't a necessary absolute that you're going to have other issues as well. It's just one of the many diverse presentations which we have. Everyone is different. So it doesn't mean that one has to, give up any hope and say, I'm going to be depressed all my life because I have autism. It's not the case.
Yes, I completely agree. Anka, would you like to add anything, or will I continue?
I guess that Dr. Gabriel covered it very well.
Okay, fantastic. I agree completely. And I've worked with many people on the autistic spectrum, successfully seeing them build this resilience, Gabriel, that you're talking about. And I think my message for this client is to keep soldiering through and keep at it. And I think there isn't a one-size-fits-all formula for healing from depression. Everybody sort of needs to find their own way through. And you can try diverse things aside from medication, psychotherapy. As Gabriel said, there are also a number of other treatments that you might consider. For example, neurofeedback, brain training, which is also known to lift mood and to stabilize our brain waves, to reduce anxiety, which also supports us to lift our mood. There's also emotional freedom technique, for example, which is a technique which helps us to get more in touch with ourselves, to become more aware of our body, and also to process negative emotions. So this is known to also alleviate depression somewhat. And you might also, depending on what type of a person you are, you might also consider certain complementary therapies, for example, like reflexology or aromatherapy. I mean, anything that works for you can be beneficial and helpful, and it might even bring some element of joy into your life and some element of control, feeling like you are doing something about it. So please keep in touch with us if you need anything else. I'm going to move on to another question. Wow, okay. We have a lot of reactions coming in also. It's really great to have this reaction from the public. Thank you for your support. Okay. I've been feeling unhappy for quite a while now, this client is telling us. How do I know when it's time to seek help? Okay. Anka or Gabriel, would you like to start?
This is a very interesting question because it's related very much to the subjective life of a person, right? And I guess that the right moment to seek help would be not only when you become, for example, unfunctional regarding if you want work or relationships or I don't know, social activities. I guess that the answer is very much related to one's person needs. So sometimes people go through existential phases, right, where they do feel unhappiness. This doesn't mean that it has to come to a point where the person becomes, for example, clinically depressed in order to seek help. There are all sorts of psychotherapies which deal as well with the existential part. So I guess that when the best answer would be, from my point of view, that when a person feels like she or he can't cope anymore, to seek for help.
Exactly. I mean, if I were to add anything to Dr. Anka's perfect answer, I would basically re-accentuate, re-emphasize the fact that it depends on the individual. Everyone has his own expectations from life, and everyone knows what he used to feel maybe a month ago, 2 months ago, his energy level, his mood. Okay, and if there is a dramatic change, which is also persistent, and one finds that he cannot or she cannot function as he or she would have if she were better, both in mood and expectations of life and so on, then maybe that is a warning for one to seek professional help. My message here would be to always keep an open mind for such things, because most of the time when we hear about mental health, and I appreciate the drive that there's been to try to decrease stigma with regards to mental health, and that's good. But most of the time when we speak about mental health, we think that it is something which doesn't affect us. It affects our neighbor, it affects someone else, our friend. But it's good to keep an open mind on these things as well. And we're living quite a busy lifestyle. Obviously, that will increase risk. So it all depends on your own personal subjective experiences.
In fact, there are people who seem to do quite well from a professional point of view, for example. And as we know, professionals, we have a lot of clients who are in managerial positions, for example, exactly, who are quite, they're achieved, right? People from regarding from this point of view, but they do have their own internal suffering, which is worth debating. And if I might, this reminds me of a client's testimonial. She was saying that at some point, if I might, I would just read directly from what she sent us, because I found it quite relevant for a category of people. So she was talking, actually she was writing about her journey through depression. And when I say through, this is a very meaningful word, because this has been a process that she had to go through and not over. Okay, so at some point she was writing the fact that, the following. The thing with depression is that while going through difficult events, you think you are dealing with them so well. She said, I felt strong, in control, and everyone felt safe around me because I oozed confidence and logic in dealing with them all. I knew what I needed to say to support others. I knew the actions I had to take to protect those around me, and I never shed a tear in the process. All this made me think I was doing all right, and never guessed otherwise. Until a few days later, I started breaking down, and this is when I reached my burnout stage. So I guess that this is very defining for quite a large group of people dealing with, let's say, unhappiness, right? Because the answer was, the question was related to unhappiness.
Absolutely. I thank you for sharing that, and please thank your client for giving us that beautiful recollection of her journey. Coincidentally, I was working also with a client this week. I find that, like you're saying, Anka, the high functioning people, those people who have, you know, maybe very prominent positions or seem to be quite successful in their lives, seem to struggle most to come to terms with the fact that they may need to reach out for some kind of support or help. And sort of my message to those people is also there's no shame, as Dr. Gabriel was also indicating. There's absolutely no shame. We are all vulnerable to mental health conditions at any point in our life. Today it could be me, tomorrow it could be somebody else. And I was working with a client this week, and she said, why did it take me so long to actually admit that I'm unwell and that I need help? And, you know, she said, I've been through so many difficult things in my life. I'm such a strong person. I've achieved so much. And it took me so long to actually realize that I needed to find help. So I think you don't need to wait until breaking point. You don't need to wait until burnout to seek help, because there's absolutely no shame in it. And within a couple of months, you could find yourself very supported and really on your way to healing. Okay. So will we move to the next question? Are you happy with that? Okay. Okay, I think this one may be specifically for you, Dr. Gabriel. Is it common for people to become addicted to medication when they're taking medication for depression? Because this is something that scares me.
Yes. So there are different types of medications for depression. There are medications which primarily act on the chemicals in the brain which are deranged when someone is suffering from depression, and these are called antidepressants. There are many different types of antidepressants. And then there are also other types of medications which help to calm someone down when he or she is in a very persistently agitated state, very restless, possibly because of the depression or because of anxiety, worry, and so on. And one must distinguish between the two. So the antidepressants in themselves, they do not cause addiction. So you can actually start them with a doctor. You are given a dose which deals with the depression adequately without being too much. And then after a while, obviously in discussion with your professional, with the doctor, you would decide to tail it down and stop. That is the usual course. And you won't have any problems provided that it is done in a timely manner with a professional. Probably while you're stopping the antidepressant, you may find that there are some withdrawal side effects like feeling muscle aches or feeling a headache, but these are very transient, maybe 1 or 2 days, and you'll be okay. With regards to the other class of medications, the sedatives, the ones which calm you down, there was this habit in the past where they used to be given for a regular period of time. So people were used to be prescribed sedative medication like lorazepam and bromazepam and these sort of things. And they are quite old drugs, but they are very effective. And they usually help because they improve mood immediately. In 15 to 20 minutes, you'll feel better. But unfortunately, after a pattern, after at least 4 to 6 weeks of taking this medication, you'll become addicted, meaning that without it, you'll start having withdrawals like shaking, like uneasiness or worry and so on. And it is this type of medication which is usually, which may usually lead to dependence, not the antidepressants themselves. So it's very important when you speak to your doctor, to your psychiatrist about these types of medication, you clarify which medication he or she is giving you. and then obviously you'll deal accordingly. International guidelines nowadays state that when we're given sedative medication, it's given only for a brief course, and it's usually given until the antidepressant starts to work. Okay, so that won't cause dependence, that will be safe.
Okay. Can you tell us some common names for those sedative medications? Maybe the public will be familiar with the names.
Of course. So there's bromazepam, the generic name, which is, the trade name is usually either Lexotan or so on. Then there's lorazepam, also known as Ativan. There's diazepam, also known as Valium. These sort of medications, basically.
Yes. Okay. Fantastic.
Thank you.
Thank you. That was really clear. I work with a lot of clients who show the desire, I mean, really the reluctance to become dependent on medication, because I think that it is human nature to want to feel in control of your life, and somehow some people feel like this medication is going to somehow take over or take away this control from them. And they show the desire to stop at some point, for example. And I've often had to have the discussion that obviously this should be done in collaboration with their doctor, and it shouldn't be done on your own, especially certain types of medications which need to be tapered down, as you were saying. And I think what we also do is when you are working towards reducing your medication or stopping your medication, we would speak very much about alternatives to the medication in terms of improving your support system, bringing in other factors in your life which can support you in a time where you may be experiencing the side effects and the withdrawals of coming off the medication, but also to help nourish you and sustain you more in this period. So I think what we're both saying is certain medications can be addictive, as Dr. Gabriel was saying, so you definitely need to consult with a doctor. And if you're considering stopping this medication, it's ideally done within the context of a supportive therapeutic environment.
In fact, Chair, just to add to your comments, I cannot agree more with what you're saying. I mean, many people approach psychiatry or the psychiatrist with the intent that maybe the medication is the destination. No, they're given the medication, everything resolves itself, the depression goes away, when in actual case, the medication is just part of your path to recovery. And if you use that mind frame when you're dealing with your own struggles, mental health struggles, and you look at medication as simply something which is pushing you along whilst also helping you build up your life again, that will help you a lot when you're trying to tail it down then and stop it.
Yes, absolutely. Anka, you want to add something?
I was thinking actually while you were talking about some clients and about the fact that indeed there is such a strong stigma related to medication, and at some point, regarding from a very practical point of view, I guess that would be very helpful for people to ask themselves, what is a bigger price? To go through suffering on raw, or taking medication because it is needed. Medication is needed in some cases, and as our client who sent us the testimonial said, this would be the smallest price to pay in order to get better.
Exactly.
Absolutely. And I also often bring in the analogy of other illnesses, and it's very interesting because you know, if someone told you, hey, if you have COVID, let's mention, and offered you the medication to get better, probably, you know, the majority of people would jump at the opportunity. But somehow, because it is a mental health related illness, people feel reluctant to take medication, and
exactly.
And it's so important to understand that just as our pancreas can get unwell, our brain can also become unwell. It's just another organ. So
exactly.
This
and
is
I cannot agree more, especially since it usually in common parlance, in the way we speak, depression is used as the name of all other mental health conditions. So you may find that someone was treated for depression, but then there were changes which were side effects to the medication which was given for the depression, so to speak. But in actual case, his condition or her condition would be completely different from the depression which the individual is experiencing. And even the treatment which one was used to be given maybe 20, 30 years ago, it has changed completely. And certain side effects, like seeing people who have become very tired, who cannot walk well, or something of the sort, you know, they are side effects reminiscent of very old medications which were used at that time because there was nothing else. And probably not for depression, but for something else. So it's very important when you think about medication, don't think about something which is dramatic, you know, which will make you like a zombie, because people use these words, you know. No, it's not the case. In actual fact, there's been so much development in the field of psychiatry and psychiatric medications.
Absolutely, and I can vouch for that because I've seen clients just become a completely different person within a matter of months of taking, you know, the right medication for them. So I absolutely agree. I have another client who's asking on our Facebook page. My mother had clinical depression and was frequently hospitalized. She was on medication her whole life. Does that mean I will suffer from depression too?
I don't know whether Dr. Ranka would like to start, or should I? It's up to you.
People do have, when we look at the causes of depression, which obviously are numerous, having a person in the family with depression might increase the chances, but this doesn't mean that it's 100% sure that you are going to develop the same. Obviously, we do have some vulnerabilities, but it depends very much on the life context and the events that we are going through. So just to make it short, very short answer, no, this doesn't mean necessarily that you are going to be as well depressed. There are more chances, might be likely, but this doesn't mean 100% that you are going to have as well depression.
Exactly. I mean, there's the genetic basis which may contribute to depression, no? But then there are so many more factors. There's one's personality, no? One's internal resilience, the external circumstances of one's life, the way in which we look at our life, the support network, whether one takes drugs or drinks alcohol. So no, I mean, I don't want this person to despair that simply because his or her mother was in hospital for depression, then he or she will be the same. No.
Absolutely. I agree. I have nothing to add. Absolutely. I think we covered that very well. Thank you. Okay. Another client is asking, yes, I think it's a similar question to what we've had, but maybe with a slight difference. They have suffered from clinical depression their whole life, they're saying here. Will they have to be on medication for the rest of their life?
Would you like me to start?
Yes, please.
So usually just a single episode of depression may remit spontaneously. So you have people who have depression, they've been struggling it for a few months, and then because of life changes or simply because of the natural course of the illness, the depression may lift. Okay, but obviously that will take a toll on the individual, because during the months when he or she would be depressed, they would feel far off from their usual selves. Now, if you have someone who has a chronic history of depression, so there's this sort of relapse remitting pattern, we say, so one recovers and then after a while one ends up having depression again. There are predisposing factors which may be biological. Yes, why not? There may be physical factors, like when someone at an early age develops diabetes or so on. But there may also be other factors which are external, which relate to one's life. So the support network at home, one's lifestyle, the work, one's expectations from life, one's personality, one's perspectives of the world, and so on. And these can be modified in order to make sure that the individual recovers. So what we usually do in this case is I sincerely like to involve the multidisciplinary team in such cases, because obviously these are complex cases and you would need everyone's eyes and ears to try to understand what's happening. And we would like to see the pattern. What is causing this relapse and depression? What is the pattern which is leading this someone to struggle so much with recovery? And I think in that case, Dr. Anka can say so much more, because obviously I'm more inclined from the biological perspective, being a psychiatrist and a doctor, but the psychological perspective is very much important as well.
Exactly. Life events are very, very much important when we deal with depression. Apart from this genetic predisposition, we have to take in account a lot of factors. I'm thinking of, for example, that in the first years of life, when our personality is being structured, our life events and the quality of the relationship that we have with our primary caregivers might lead in later on in life, why not sometimes to have feelings of very much what is everything related to depression. Obviously, when we are structuring ourselves, we do structure our psyche in relationship with others. So then when we're searching for the factors which contributed to depression, we go as well in the family dynamics, in the family history, and in what was happening to a person's in their crucial points of life, let's say, in their stages, through their life stages, developmental stages, I would add. So obviously, it's all time, I think that it's very, very difficult to pinpoint exactly and to say, this is the cause of your depression. People want answers and they want to find out causes. In most of the cases, we say it's likely that, but it's never 100% sure, because the same experience is filtered in a very different way from different people. For example, losing a parent, right, in your early childhood doesn't lead necessarily to a clinical depression for some of the people. For some others, yes. So the subjective experience is very much important.
Absolutely, absolutely. I think what I'd like to add to those fantastic responses is the other side of the coin, in a way, to balance things out, because I think there is a small percentage of people who do need to take medication for life. And what I'd like to say is that there's absolutely nothing wrong with that, and there's no shame in that either. Because I have worked with clients, I have some clients who I've been working with for 18 years, and there have been numerous occasions where they tried to come off their medication with a lot of support, because they wanted to see if they could do this on their own. And then they find that they're better off on the medication. And that's okay too, you know? So I don't think there is any definite answer to this client's question. As we are all indicating, there is a subjective experience. Depression is experienced in a different way by different people. And the causes are so diverse also that we need to treat each client, each patient as unique, with their own presentation of symptoms and their own unique care plan, ultimately. Okay. So anything else you want to add?
No, thank you.
Good, all right. So, okay, so I think this is a very important question, which a lot of people, I think, try to avoid. This client is asking, how common is it, and is it normal that people who suffer from depression think about harming themselves? Okay. Anka, would you like to start?
People with some of the people who experience depressive symptoms might have self-harm thoughts. It is not though necessarily that all people going through a depression think about self-harm or think about suicide. There is a number of clients thinking about this, but depression does not imply in all cases self-harm thoughts. Obviously, it's very important to pay attention to people near us, and especially to our family members. And I'm thinking now more maybe about teenagers, where apparently the risk of self-harm it's higher in their cases. So as for family members, it would be very important to first of all not only to observe the changes, for example, in person's in your child's attitude, right? The child being in this case the adolescent, for example. But as well to pay attention to offer him that safe space where the child can communicate with you in order to prevent such things to happen. I don't know whether I have answered your question.
Absolutely. Yes, I agree. I was going to add to that as professionals, we very often discuss thoughts of self-harm and thoughts of suicide with people. And for me, I do see different levels of these types of thoughts. The first level would be quite a normative experience of people who occasionally say, for example, I wish I won't wake up in the morning, or I just want to die, you know?
Exactly. And that is a normal part of the human condition. Sometimes we do say these things.
Absolutely.
Obviously, don't commit them. Exactly.
Absolutely. It doesn't mean because you're having these thoughts that you're suicidal or that you're actually going to act on them. As Anka said, there are existential experiences that we go through, and sometimes we do find ourselves preoccupied with death and thinking about it. I think the other level would be when we become obsessed with these thoughts and they start to take over our life a little bit more. And then maybe we need to start to think, okay, what's happening here? Maybe I'm thinking, maybe I'm more connected with dying than with living. So there's something maybe disbalancing. Another level would be if you find yourself having a plan, an actual plan of what you will do, how you will do it, when you will do it. And this is where, you know, alarm bells should start to ring. And if you are feeling this way, and if you do have a plan, and if you find that things are getting a bit out of control, you really, really do need to reach out and get some support from people around you. And if you are around people who have indicated they have a plan to harm themselves in this way, it's very important to take immediate action. And then obviously we have suicide attempts, which then is obviously another escalated level. And I often hear people saying things like, oh, it was just an attention-seeking act or a cry for help. But these cries for help should always be taken seriously. And even if it is just a cry for help, this person needs attention, this person needs love. this person needs validation and this person needs support. So we should take these things seriously always. That's what I wanted to say. Would you like to add anything, Dr. Gabriel?
No, I think you've exhausted the topic very well, and I can't put it better than that. I mean,
Okay.
the important take-home message is basically that these things are to be taken seriously, but that doesn't mean that one should be afraid of speaking about them. Eh?
Actually, there is something I can ask you specifically, if you don't mind. If I happen to know that my neighbor, for example, is actively suicidal and they happen to knock on my door and tell me that they're going to harm themselves in some way, what should I do at that point?
So what I would advise anyone who will go through this experience is actually, first of all, make sure that the individual who's saying this to you is in a comfortable setting to speak up with you. You know, if someone says this while crossing the road, I mean, invite them in or sit down, speak to them. Don't do these things in a rush. This is an important statement, and it should be given time in order to be understood. The person should be understood. Secondly, one should understand the reason behind what someone is saying. So if you've mentioned, Cher, that this person would be actively suicidal. So we're saying here, in simple terms, that the person has decided that he or she will be committing suicide, and that this decision is very strongly kept. It's very strongly adhered to. So in that case, obviously, this is a matter of immediate urgency. In which case, obviously, while sitting down speaking to this individual, making sure that he or she is safe, I would actually advise the individual to wait here until you speak to a doctor or you call the ambulance, and the doctor will come and visit and assess accordingly. Not every suicidal threat is an actual threat of suicide. It can be many things. As Cher said, it can be a cry for help, but nevertheless, it should still be seen by a professional before a decision.
So you actually call the emergency helpline in that case? Gabriel?
Yes, that's what I would do. Yes, I would
call
call
112?
Exactly, 112, and also make sure that obviously the person who said this is next to you in a safe setting as much as possible, relaxed. And sometimes people, when they say these things, it shows that they have ambivalence, meaning that they're not completely sure. Because if one were completely sure that he or she would be doing suicide, they wouldn't tell you, they would just do it, you know? So the fact that someone said it still is very serious, because that means that someone is probably asking you whether he is still worthy of life or not. And so you should be there, you know, to support and to recruit help as much as possible, as quickly as possible.
That's a really beautiful way of putting it. That's when a person comes to you at this point in their life, you can make such a valid contribution to them at that point by actually showing them, listen, I care and your life is important to me, you know? Thank you for that.
Thank you. And diaries of people who attempted suicide and were very clear on committing suicide and then survived the suicide. You can see memoirs, stories of people who tell you, listen, I kept on asking people, even strangers, whether my life was worth living. And the fact that they refused to give me any form of assistance or any consolation from their words led me to do it as well. So it's very important to understand our role here.
This is very powerful, especially when we consider the type of climate we are living in, where people are becoming more and more isolated, more and more individualistic. And it's so sad to think that our suicide rates are going up at a drastic rate. And sometimes it's just even about this person actually feeling valued and actually feeling worthy of being alive. And so how important it becomes to have this kind of community, this community support. Well, it doesn't have to be a whole community, even one person can make that difference, you know?
Exactly.
Okay, Hankar, would you like to add something?
Not much. I totally agree with you. And while you were talking, it crossed my mind how important is this need of community and attachment and care. In fact, apparently nowadays, the depression, it went, how to say, way higher, right? Being to such alarming proportions. If you had to compare what is happening now to what was happening hundreds of years ago, and just to take in consideration all these factors as community, industrialization, the need, isolation, disconnection. I think that this would be the word, disconnection. That is very much understandable that depression developed a lot. So going back a little bit to the roots, yes, people and especially people with depression, they have a need of attachment, of attachment, of being seen, of being supported. So
Yes.
we would encourage everyone to support people with depression and to take them in serious and not to minimize their pain and sufferings and words, actually, especially in such cases.
In fact, the most common thing I hear from people who are actively considering suicide is, nobody will notice I'm gone. It won't make a difference in anybody's life. And sometimes this is just their perception because they are feeling so depressed. But sometimes it's true that they are very isolated and very lonely. And these are the people who I would worry about most, you know.
Exactly. And it is ironic because obviously today we are connecting with people through virtual means. Even this actual live panel, it is being facilitated through virtual means. So we should be connected more than ever. But what we actually crave is a human connection, that someone actively listens to you, not just, just speaking to just say that I've spoken to you now, I'm okay, my conscience is clear. No, a deeper level of connection.
And I also find that people are afraid to speak about suicide or about death wishes, and they think that if you talk about it, it's going to make it worse, and that you're going to encourage the person to do it more. But definitely, the research does not indicate that, the literature does not indicate that, clinical experience does not indicate that. It's actually this need to connect, as you're saying, and speak about this that actually can be more healing rather than avoiding the subject. And sometimes parents tend to do this too. If their adolescent speaks about wanting to die, they say, oh, don't speak about these things, and don't be silly, and don't let me hear you speaking about this again. And I think in actual fact, this is the worst thing that can possibly be done.
Exactly.
If I might add something, Dr. Gabriel said a very key word. He said the word human, and this brings me to something that I have read while I was thinking about, obviously, this topic and how we can provide support from people watching us now. I was going through some articles, and one of the articles, which is called "4 Decades of Outcome Research on Psychotherapies for Adult Depression." Well, obviously they have examined some different trials, and the results show that therapies are effective. That it's, for example, that it's CBT, that it's psychodynamic therapy, that it's interpersonal therapy, and so on and so forth. All therapies are effective in specific target groups, such as older adults, college students, and so on and so forth. And treatments are effective when delivered in individual form or in group or guided self-help format, and less effective when they are delivered without human support. So it's this is the central, I guess that this is the central element, human support.
And relating. In fact, I was reading another piece of research that indicated that all these therapies you're talking about, Anka, CBT, psychodynamic, etc., clients and patients indicate that what healed them most was the relationship with the therapist. So I think this is so valuable, you know. It brings me to our last question, and we'll be closing our panel. And briefly, this client is asking, what can I do to avoid getting depressed? And is medication the only route? So I think we can try and combine this question into maybe a preventative
Exactly.
experience where medication is not involved. What do you do, Gabriel, when clients come to you and say, I don't want to take medication?
Exactly. So yes, I do have clients. I do have clients who say so, and I do my utmost to respect their decision. The only issue would be when the depression is so severe that they cannot judge the severity of the depression itself, such as when, for example, they are considering suicide and there's a considerable risk. But most of the time, the depression is not that severe, thank God. And obviously, a person can do much more than just take medication. And in that case, I would advise a healthy lifestyle, a healthy and balanced diet, including sports at least 3 times a week, which isn't that much of a big deal because people will tell me, but I'm super busy. I return home at around 8 in the evening and leave home at 6 in the morning and so on. Yes, but we find time to do so many things, and just 30 minutes of a brisk walk around your neighborhood may do wonders for your health, not just physically, but also mentally, at least 3 times a week. Nothing big. You know, try to include music and try to find the time to reflect upon yourself and to spend time alone, not in a rush. Maybe sometimes we can disconnect from the internet, from mobile phones, and spend time with our loved ones, genuine time where we relate, as Cher and Anka rightly said. You know, so these things, the fact that we're living a very urbanized lifestyle, that we forget how greenery looks and what sky it is today, you know, these things make us less human, and they're also leading us to an increased rate of depression. And also something else, I think everyone should try to understand his inspiration in life, his purpose in life. And this leads me to a sort of existential point of view, but it's very important because sometimes we rush by, you know, with Christmas is soon coming and people will say, oh, I recall last Christmas we were so different, there wasn't any COVID and everything, and it rushed by this year, I don't know how. Yes, but it's always the same thing. We always say the same thing. And why are we living so fast? Why is it that we live day by day, but we don't appreciate the days which have passed? It's because we sometimes live simply in order to finish the tasks at hand without looking at the bigger picture. And I think one of the greatest protective factors for depression is actually knowing what you're living for, knowing what you stand for, whether it's your family, whether it's your job, whether it's a blend of both, which is good and nice. I think suffering is part of life, but it doesn't mean that suffering will make you depressed. It's just the mission which you have in life which will give you strength. So that's my advice in a nutshell.
Wow.
Thank you.
Fantastic. Thank you. Anka, over to you. Final.
Well, Gabriel mentioned so many things that there are little left to mention.
I'm sorry.
And I was thinking, actually, that is very important as well to process your feelings and to take into account that, yes, negative emotions are present. We do not have to get over it, but to go through it, to process it, and that it's not to block necessarily all the negative experiences that we have, to go through it. And as I said, this is a very important word in my work as well, to process it, just to process your human experiences and to contain yourself, and obviously wherever is possible to to share yourself with people, to connect with people.
Fantastic. And the word that comes to mind is mindfully. You both indicated sort of living more mindfully, and I think we hear this word a lot. And some people think it's kind of some kind of, you know, mystic guru thing, but living life mindfully simply means being present in what you are doing in this moment, experiencing your emotions, looking at the greenery, smelling the trees, watching the waves as they lap onto the shore. And, you know, this really does ground us and give us more of a nourishing experience of life. Anka, you wanted to say something?
Yes, if I might add one last idea, would be the following. People with depression, they feel very much ashamed of themselves. They fear very much criticism. And I would suggest the family or the friend just to try to understand them, to be there for them, and not to minimize their feelings, because otherwise it's very difficult for them to go through it and even to arrive to that point to seek help. So this would be like a message for
Absolutely. I just want to end with 2 points, which I'd like to add to what you both said. The importance of creativity and stillness, which for me are 2 very important values that we are minimizing in our busy, urbanized lifestyles. So the creative element in human beings is so important. Try and tap into your creativity, being or doing whatever it is that helps you express your creativity, whether it's cooking, whether it's gardening, whether it's playing the piano, playing some music, learning the guitar, writing. It's so important for us to express our creative energy, and so many of us have lost this nowadays. And also the importance of stillness. We are busy constantly on this kind of treadmill, and the proverbial hamster wheel, going around, trying to get there. And very often we don't really know where we're going. But to create moments of stillness in your life, as Gabriel was also saying, either being one with nature, or perhaps trying a meditation on YouTube where you can just sit or lie down for 10 minutes and be still, or even to have a bath occasionally instead of the quick shower. The importance of stillness.
And to observe.
Thank you all.
To observe and to observe things and life around you rather than to focus only on your thoughts.
Absolutely. I think we could speak about this all day, but we don't have the luxury of time. But thank you for joining us and taking time out of your weekend to be present with us here today. Thank you to all of you who have tuned in. Final message, if you are in need of help, do reach out. There is help out there, okay? I do hope that you found this panel somewhat helpful. And we'll be coming to you in the coming weeks and months with more information. And as Gabriel was saying, let's destigmatize mental health issues. There's no shame in it at all. We're all human, we're all vulnerable in our own way. And let's just work together and support each other. Okay. Thank you so much.
Thank you.
We'll be in touch. Bye for now. Bye-bye.